I just listened to the most recent episode of the Tim Ferris show where he interviewed the world's leading expert on the vagus nerve, and here are my takeaways. This is Dr. Kevin J. Tracy, and he has been probably the most important person when it comes to studying the vagus nerve in the last 30 years. He's a neurosurgeon, a researcher, and he's also president and CEO of the Feinstein Institute for Medical Research. He also recently published this book called The Great Nerve, which he talks about the vagus nerve and how it can interact with someone's life and overall health. Him and his team also played a pivotal role in developing a device where you could actually implant a stimulator onto the vagus nerve used to treat moderate to severe rheumatoid arthritis who had already failed treatment with biologic medications. My first takeaway is that my view of the vagus nerve is pretty congruent with how Dr. Tracy sees the vagus nerve, and it shouldn't be surprising because most of my views on the vagus nerve, especially its anti inflammatory effects, were actually driven from a lot of his seminal research and a lot of his writings. One thing I did learn from this episode is something that I had some feelings and thoughts about, but actually was confirmed by Dr. Tracy. Vagus nerve stimulation is unique is that it can actually reduce inflammation without causing immune suppression. Drugs often used to treat rheumatoid arthritis and lupus often have the side effect of being immunosuppressive. At times, this immune suppression can be quite dangerous because a patient that is taking these drugs can actually get life threatening infections. And he made an interesting case saying that biologic medications oftentimes wipe out 100% of a patient's immune cytokines, which are often used to fight off infection. But vagus nerve stimulation can actually reduce these cytokines by about 70%, which means that you could get the inflammation levels down below the toxic levels, but still have enough to fight off some of these infectious organisms. Second thing I learned is that Dr. Tracy doesn't actually consider non invasive vagus nerve stimulation units to be effective vagus nerve stimulation devices. He said that in order to get sufficient specificity of vagus nerve stimulation, you either need an implant or you need to use an ultrasound device to actually do it properly. He made a strong case saying that the non invasive devices might be helpful for a patient and might get some vagus nerve activation, but it's tough to know exactly what mechanisms are working on because you're stimulating multiple nerves at the same time. And the last thing that he seemed most excited about is this concept called immunoception, meaning that you might be able to use bioelectric medicine like vagus nerve stimulation to actually change the plasticity in the brain and how brain plasticity might be affecting our immune responses. It opens up exciting possibilities where we could try to understand someone's disease state or pain state by mapping their immune system on their brain and using electricity to modulate the way that the brain functions. Definitely check out this episode. There's a lot of really cool stuff in there that might not be that practical, but I think it paints a really promising picture at the junction between the nervous system and the immune system that might be the future of medicine. I personally still think that non-invasive vagus nerve stimulation still has applicability, especially for migraines and a lot of other general health issues. But when it comes to treating major disease states, then you're definitely going to want to opt for an implant.